Hello friends. Today I am going to tell you about avian flu, i.e. bird flu, but before that, subscribe to the channel if you have not subscribed till now. Avian flu, also known as bird flu, is a viral infection that primarily affects birds, but can also be transmitted to humans. It is caused by the H5N1 and H7N9 strains of the influenza A virus. The disease is usually spread through contact with infected birds or their droppings, and can be fatal in some cases. Symptoms of avian flu in humans can range from mild to severe, and can include fever, cough, sore throat, muscle aches, and headache. In more severe cases, the virus can lead to pneumonia, acute respiratory distress syndrome, ARDS, and other life-threatening complications. In rare cases, avian flu can be fatal. Treatment for avian flu in humans depends on the severity of the illness. Mild cases may only require supportive care, such as rest, fluids, and over-the-counter pain relievers. However, more severe cases may require hospitalization and treatment with antiviral medication such as oseltamivir, Tamiflu, or zanamivir, Relenza. These medications can help to reduce the severity and duration of the illness, but they must be administered within 48 hours of the onset of symptoms to be effective. Preventing avian flu involves taking precautions to avoid exposure to infected birds or their droppings. This includes avoiding contact with live poultry, cleaning and disinfecting surfaces that may have come into contact with infected birds or their droppings, and cooking poultry and eggs thoroughly before eating. Travelers to areas where avian flu is common should also take precautions to avoid exposure, such as wearing protective clothing and avoiding areas where birds are kept. Vaccines for avian flu are currently available, but they are not widely used in humans. The vaccines are designed to protect against specific strains of the virus, and are recommended for people who work with birds or are at high risk of exposure. However, the effectiveness of these vaccines can vary depending on the strain of the virus, and more research is needed to determine their long-term safety and efficacy. In conclusion, avian flu is a viral infection that primarily affects birds, but can also be transmitted to humans. Symptoms can range from mild to severe, and can include fever, cough, sore throat, muscle aches, and headache. Treatment involves supportive care for mild cases and antiviral medication for more severe cases. Prevention involves taking precautions to avoid exposure to infected birds or their droppings, and travelers to areas where avian flu is common should take additional precautions. Vaccines are available but are not widely used in humans, and more research is needed to determine their long-term safety and efficacy. It is important to stay informed about avian flu and to take appropriate precautions to protect yourself and your community from this disease. Thanks for watching. Subscribe to the channel if you are not already subscribed.